Okay. Good afternoon, everybody. Can you take me off this thing? It's always my bad side. Good afternoon, everybody. Let's call this meeting to order. Having a joke, I hate seeing myself on the big screen. So this time I go the way it is on the agenda. And Senator Hufstetler, you are bringing a bill that I am very glad that the Senate has decided to send it over. This is a bill, everybody, that the House has passed last year and sent over to the Senate, and due to COVID that it died. And so I'm glad that Senator Hufstetler took up the call and is sending it back to us.
Well, okay. You took the words out of my mouth.
Pardon?
I said, you took the words out of my mouth.
Okay.
That has happened to me a couple of times too, but I hate it when it does. But I know this one got through the House last time. It didn't get through the Senate. COVID had some priorities cut down, I guess. So I was asked to try to get it through the Senate side this time and back over to the House. And it actually, I was hoping it was going to go to our Health Committee, and instead it went to Judiciary.
Oh.
And believe it or not, with all those lawyers over there, I kept your language intact word for word. Not a single word changed in the bill.
So this is
I try to stay away from
passed out for Senate Bill 164.
Yeah, and just quickly, it's working with the prosecuting attorneys, with the AIDS Coalition, with the Department of Community Health. Sections 1 and 7 is language that the Department of Community Health wanted in there that says they don't approve tests, because they don't. That language shouldn't have been in there. And 3, 4, and 5 are really just talking about needles, that we don't criminalize those anymore. I know you've been involved in setting up needle exchange programs. So that's no longer needed. And then the other section, I was doing good for a while there, but
Gets our,
yeah. The other section is where a couple of things there. We recognize the HOPE Act, which says that it's no longer criminal to donate a kidney or something from one HIV person to another HIV person. You know, some of these laws are back from the 1980s. And in fact, we are doing that and have done it, I think, at least 100 times. And it could be from dead or living, but both are HIV. And the fact that the prosecuting attorney said that the original language had 2 problems. It criminalized negligence, not intent. And there were some conflicts with the blue legislation that really they wanted to go to that language instead. So I can talk more if you want to. The witnesses can. I'd be glad to shut up at this point.
We'll take questions from the committee. Okay, we have a couple of people that want to speak on the bill.
And if they're from the AIDS Coalition, some others, they said they didn't have to speak unless you needed the testimony.
No, I think, is it Maddie Lynn Causey? Oh, okay.
Hi, Chairwoman Cooper. This is Maisie Lynn Causey from Gactyl, and I'm in the same position as the other folks. Just wanted to be available to you if you needed our comments, but we are very supportive of this bill, excited to see it moving through, and think that this is going to bring a lot of dignity to what can be a very difficult process for our clients.
Okay, anybody questions for Ms. Causey? She's with the Georgia Station of Criminal Defense Lawyers. No one has a question. Okay, and Nina Martinez. Martinez. Okay.
My name is Nina Martinez, and I'm here representing people living with HIV. I want to thank Senator Hufstetler for echoing in his testimonies of the bill, echoing what are actually my real stories. I became 2 years ago this month, I became the first living donor with HIV to donate a kidney to another person living with HIV at Johns Hopkins Hospital. I donated to somebody I did not know, somebody who had been on dialysis for 1 year, someone who was highly sensitized. So he had antibodies to a bunch of other donors, but he didn't have antibodies to me. He's doing well, to the best of my knowledge, in the Washington Post. But I did have to travel to Maryland because I couldn't do this in Georgia. The other unintended consequence of having the law as it is that 12 years ago, I was sexually assaulted and did not report it because the law did not take into account intent to transmit. And the only thing that you needed to have to be able to prosecute is knowledge that you were HIV positive. So the very real risk of going to prison for my own sexual assault was something that was very real to me. And it means very much after 6 years of trying to raise awareness of the issues with this bill and how it does cause harm to people living with HIV, such as myself, when most of us are really just trying to live our lives. And you know what? Science has evolved, and so should we. Thank you.
Thank you very much for coming and speaking on the bill, and for the courage to speak out for others living with HIV who maybe don't have the courage to come before a committee like this to do it, because we need to hear that kind of testimony. Okay. Representative Trocas.
Thank you, Madam Speaker. Thank you. Chairwoman
I thank you, but
Cooper.
I don't want that job.
I'm sorry. Anyway, I'd like to make the motion do pass for Senate Bill 164.
Okay, we have a motion to do pass. Do I hear a second? Okay, further discussions, more questions from members of the committee? Okay. Got women, is there something online? Okay, then I will take everybody in favor of the passage of Senate Bill 164, say aye.
Aye.
Anyone opposed, say no. The ayes have it. It's 100%.
Thank you to the
positive.
committee, and I believe you're carrying it on the House side, aren't you?
I will be delighted to carry this one. I'm very excited about the passage of this bill,
All right.
so
Thank you.
that we update our laws to reflect the science, what we've learned in science and all the latest development in medications and treatment modes. Okay, next, Senator Dean Burke, Senate Bill 46. Let's go with the easy one first. Or no, the other one's easy too, but
Thank you, Madam Chair. Yes, ma'am. I think they're both easy, but maybe biased a little bit. And thank y'all for the work on that bill as a women's health provider. And having dealt with that issue my whole career, it's nice for the science to catch up to the social side. So it happens every now and then. So I appreciate y'all's work on that issue. On Senate Bill 46, y'all might be thinking deja vu. Didn't we just get rid of this? But some of your concerns were heard. I know y'all may think that's rare around here, but the process does work and bills get perfected during the process. And so we had some input from the department, as well as one of your attorneys, not on this committee, but one of the attorneys in your house. And so we've made a couple of changes in Section 3 to help people with that privacy concern. And I'll be glad to answer questions if we need to. But again, I want to respect y'all's time.
in one of the, okay, is it the same on line 51 and 52? Is that the way the consent of the person, I say regarding any person may without the consent? That's the same as it was. Where it is, the change is on line 62 and 63, correct?
62, the person's name is not provided. That's the new language on that. And then there is the chairman. The other one is a deletion of a line that was in paragraph 2 that's gone now.
Okay. And that had to do with the privacy rights also that
Right.
people question.
Right.
Okay, questions from the committee?
And the department is supportive. This is, something we've been
Right.
working with them on.
Does any of the committee have questions? Anybody got questions online? Okay, want to hear from the department? Okay, Megan?
Hey, everyone. Again, this is Megan Andrews, Director of Government Relations for the Georgia Department of Public Health. We did hear some concerns about the privacy, so we did kind of tighten up the language and narrow the scope to address those concerns. So Representative Kelly can probably answer some of the questions about the narrowing of that scope, but the language about how we send data to the CDC, it's now clear that we don't send patient names. As I said before, the only identifiable information that the CDC gets regarding vaccination data is the patient's date of birth, which is still identifiable, but we're just making clear we're not sending the patient names. And then the other piece is in paragraph 2, it talks about exemptions from the registry. So patients can request to not participate in their data being entered into the registry. There was language in there that said during a state of emergency, if it's a vaccine administered pursuant to the state of emergency, then you can't exempt yourself. So we wanted to make sure that constituents of Georgia still had that flexibility. If they felt the need to exempt themselves from the registry, they had that ability.
Yep. I guess I just don't understand why somebody, I mean, because if you want to refuse the vaccine, you can. But this would be after you took the vaccine, then you didn't want your
data.
In there. And I mean, and since you don't give anything out, the names and stuff, I can't imagine why, if you had already taken the vaccine, why this would be a problem. Have you ever had anybody say why that might be a problem?
I mean, we do have people from time to time request exemptions
Just because
they don't want the government to have their records.
Okay. All right, Whip Kelly.
I was just going to try to, jump in here, but Megan did a great job answering that, Madam Chair. Just some of the concern I had is, we all share this goal of having as many people vaccinated as possible and being able to use the data that we collect to help us determine where it's more effective. And so just to encourage people who may want to have the vaccine, who may want to share most of their data, but don't want to quote unquote be on a list. I think they part of the principle that I heard from some people, if it ever got out who was on the list, you would also know who's not on the list, and to prevent some retaliatory or other things as well. So I appreciate the department working with us on this. They've been great partners, and thank you, Madam Chair, as well.
Representative Barr.
Thank you. I appreciate y'all working on this very much, and the Senator, thank you for taking my concerns into consideration. And I will say to Representative Kelly's point, I represent some of those folks who have some of those concerns. So thank you very much. And just my question, just to make sure, this does satisfy y'all, and y'all did a great job, but this does take care of what we need to take care of.
Yes.
Correct?
Yeah, absolutely. We'll still get the information that we need and still be able to report to CDC. It's just making it clear and kind of narrowing the scope to what's actually needed.
Very
So,
good. Thank you so much.
Yeah, you're welcome.
Representative Sharper.
Thank you, Madam Chair. Question for you. Did y'all ever decide if you just kind of just make it to where all the emergency medical technicians are able to do this at every level? Is that what you're after?
So I talked to our EMS director about that last week, and I did send you an email with some additional details. So
Okay.
DPH, as the regulatory agency over the practice of EMS in Georgia, we license these folks, and we set their training requirements and all of that through our regulations. And there's actually 3 levels of EMTs. There's basic, intermediate, and advanced. So our director of EMS is going to provide some clarity in our regulations on the scope of practice to make sure it's clear on which level can do what.
Okay, so my question is, in regards to this bill where it says emergency medical technicians, do you want all of them to do it or
No.
not? Because when you have it on here, all I'm saying is, if you have it on here, emergency medical technicians, we just need to be clear of who you wanting to do this. It can be all 3 levels. You know what I mean? Because advanced can already do it, but if you want the others to do it, that's what it's going to specify, needs to be specified.
Let me turn this over to Betsy. Betsy, is that okay? Can they do that, as Megan says, where they make it a scope of practice and each group of those levels know what their scope of practice, and so they would be stepping out of it if they did something that wasn't in their scope of practice? Is it clear? If they
It's,
can do it by regulation.
yeah, they're doing it now. The department's doing it now, to my knowledge. They basically, in their regs, have sort of more levels of licensure than are reflected in the code. So they've kind of bifurcated that out already in different scope of practice. So they, it seems it would follow, they would be able to do the same thing with this particular authorization. So yes.
Does that answer your question, Representative Sharper?
I'm good. I mean, yeah, that's fine. I mean, it does and it doesn't, but I get it. They're not gonna let them go beyond their scope.
Their scope of practice.
Right.
Right.
Okay.
Other questions for Megan or the author? Okay. Do we have somebody else? We have no one to speak on the bill. Okay. It's the appropriate time. You wanted it? Okay, Whip Kelly.
Madam Chair, I make a motion to pass on the House Committee substitute LC 338773S, substitute to Senate Bill 46.
We have a motion and a second. Is there any more discussion from members? Anybody online? Okay, no discussion. Everyone in the favor of the passage of the substitute to Senate Bill 46, say aye.
Aye.
Anyone opposed?
Aye.
Pardon? Anyone opposed? No. Okay, we have it. Thank you very much, Senator. And we're ready for your next bill. 256.
Thank you, Madam Chair. 256 is another bill dealing with the Department of Public Health, and there's been a lot of work done by that department this year, obviously with the pandemic, and they have done yeoman's work, but there are some areas that I think the department and the legislature have realized that perhaps we could improve upon, and that's kind of our goal, is to always make things better. So this bill is started out as a much wider revision of the Public Health Code, and for a lot of varying reasons, we felt like the bill was too much work for the shorter period of time that we had to do. So we limited it to one area that we thought could give the commissioner some support. And so this bill just basically states that the commissioner can appoint the district health director, and that district health director serves as the CEO of each health district. So fairly simple in scope, and I think it will provide the commissioner a lot of more time to do what she needs to do.
Okay. Questions for the author of the bill? Representative Hogan.
Thank you for bringing this bill. Who appoints the health directors now?
The commissioner appoints, but every county in each health district gets veto power, is my understanding.
Would that change that? Would that be
That would
changed?
change that part of it. And
Thank you for bringing this bill.
Thank you.
Other questions for the committee? Who's that? Barr? Oh, Representative Barr. No?
Thank you. Could you walk us through the actual process? If I'm qualified, do I then send in a resume? Help me understand this a little bit more, if you don't mind.
Well, by statute, and Betsy can help us if I stray. By statute, the position does require a medical degree. So those people have to be an MD. But otherwise, it's just a normal application process when there's an opening through the state. Where the commissioner gets bogged down is these districts are huge in a lot of parts of the state. I believe there's 18 health districts, and some of those districts have 15 or 20 counties in them. And so it's very, very unwieldy to have to try to meet with every county to get approval for her choices, the one she wants. And if there's a problem with that commissioner, then the reverse is the same thing. So basically, we're giving the commissioner, in my mind, the ability to hire the staff that she wants to work with and the ability to fire them if she has a problem with it. I mean, that's the simplest way I can put it.
Follow up.
Sure.
Two questions to follow up. One then, so would the removal be completely to the discretion of the commissioner at this point with this?
That would be
legislation?
my understanding, and of course, following, all HR guidelines that all of us are faced with. So.
Very good. And then just a technical question. The counties, however, are on the hook for the salary of this person. Is that correct? Or the district?
I think those are state-funded
State paid.
positions. The county officials, some of the ones that work in a local health department, there's a combination, with the funding formula that the state and the counties have part of that role. But if my understanding is the district health
Very good.
directors are all state-funded.
Thank you, sir.
Representative Hatchett on video.
Thank you. Thank you, Madam Chair. Senator Burke, you did mention in your answering one of those last questions that the director still does have to be a physician, but in the part of the section that you're changing, it's lining through that. So I guess it does say that somewhere else in that code section.
Betsy?
29 actually has it.
Right.
Thank you. Yeah.
It's on line
Thank you.
29.
Thank you.
You're welcome. Do you have a copy of the bill? Matt?
Yes, I do. I just saw,
Okay, I was going to.
when you said that, I saw it. Thank you.
Okay. Representative Fry on Zoom.
Thank you, Madam Chair. Would you say that that this bill is not changing the qualifications of that position, but it's merely creating a more of a structure where we might get some homogeneous interpretations of different regulations from district to district with this legislation?
Well, that is the goal. The broader reorganization, I think, is still needed because of that issue. But this is a baby step in that direction, Representative.
So I think that's a good way to put it. A main issue on it, Representative Fry, thank you. Do you have another question? Is that it?
No, ma'am. Thank you very much. Thank you for the author of the
Thank
bill.
you very much. Okay. Okay, we have David Will would like to speak on the bill.
Yes, ma'am. Thank you, Madam Chair. My name is David Will. I'm an attorney, and for the first 8.5 years of my career, I was an assistant attorney general for the state, and I represented DHR, which included DPH at that time. In my 32 years of private practice, I now represent county boards of health, and I have represented them throughout the state. I currently represent the district that includes the Gwinnett, Rockdale, and Newton County Boards of Health. All three of the boards and the city of Covington have gone on record to oppose this bill in both its previous original form and the current form. This bill changes over 50 years of law. Since 1964, when the Public Health Act was passed, boards of health have been allowed to say in who is the district health officer. And they were allowed to also have a say in the aides and assistants chosen by the district health officer. It has worked, and it has worked well, and there's no reason to change it now, particularly in the face of an epidemic. When you have departments as functioning as well as I do in my district, which is accredited, nationally accredited, like the Cobb County Department, also nationally accredited, and it goes back to local governance. We don't need a cookie cutter approach by the State Department dictating how each person's going to be selected, how each priority is going to be done. Local governance allows the local Board of Health to establish the priorities that they want and working with their local community partners to establish what needs to be done in each of those counties, whether it's HIV, whether it's women's health, whether it's cancer, whether it's aging issues, whether it's TB, or how we deal with the pandemic. The bottom line is this bill will take away all the local governance that's now formed in those local boards of health. In answer to one of, I guess it was Representative Hatchett's questions, the department now pays the district health officers. They are state employees, but they do receive a county supplement in many cases. And county supplements, I feel certain, would go by the by, because no board of health is going to want to pay that if they have no say in the selection of it. I'd also point out to you that as part of the accreditation process, they must demonstrate local governance. And I think it would be impossible for those departments that are accredited now to retain national accreditation if this bill passes. You might remember when the Surgeon General came last year to visit, they came to the Gwinnett County Health Department to see how things were done, to utilize that as a model for the rest of the nation. So things are being done at the local levels that are very, very good. And they would just go by and pass by if the department has complete control of the local selection of its officers and how they're organized. Because right now the boards of health can say, hey, we need this clinical person as opposed to someone in administration. And I think this is just bad public policy.
Thank you very much for your testimony.
Thank you. I can answer any questions if you have.
No, but I guess what, and I applaud your county and it being a star county, but we're having a real problem across the state. And, it is not the intention of Dr. Toomey or the offices to, go in and, with the really good examples. In fact, I think she probably would like to use them as examples to help other counties. But predominantly, a number of our facilities are not functioning well. And they're doing things like, we were set up several years ago in one of the districts in one of the counties to do telehealth with new mothers and all. And the nurses decided they didn't want to do it. And so it wasn't done. In another area, when they do blood work, and this is several areas, they do not do a chart on the patient. They just pile up the bloodwork, stack after stack of the blood results. There's no way to tell, how many patients they see a day. In many of our public health places across our state, there's one car that sits in front of the public health office all day long, and it's the person who works there. Often, it's the nurse that works there, and it's the most expensive car almost in some of those counties, and nobody comes to those units. They don't want to do, now with all of the wonderful things that we have where we could use our public health departments to do prenatal care, they don't want to do it. We are having real problems across our state. So I would say to you that they haven't been working for 50 years, that that they're not doing. And we've had the same thing with the immunizations. So we have pockets of really functioning areas, but those pockets are very few. And that is what this bill is trying to do, is to some continuity, because before that, the district officers paid by the state only had the ability to suggest, and then the local boards do what they damn well please. Like we put into law that if you're going to give immunizations for flu, that you should have a 15-minute waiting period. One of our counties has drive-throughs, so that people driving 5,000-pound cars just get a shot in the arm and continue, just drive on off with no waiting period. What if the person has a reaction to it and faints or whatever? So this is the kind of thing that I think that this bill is trying to do, so that there is some oversight for the person who pays the main bill, that maybe we can have some oversight into how the direction, and when we ask them to do something to help us get patient care across this state, that there's a more positive response to it, and not just, we don't want to do it, so we're this county in Georgia and we're not going to do telemedicine, or we're not going to help do prenatal, visits and help us cover the counties that have no OBGYN. So I just, would beg to differ with you, having looked at these problems for several years, that we've had a good functioning system. And, that is just because I've been involved in it. So thank you very much.
Thank you.
Three.
Thank you, Madam Chair. Many of my questions were answered by Representative Barr's comment about the current process, but I do have a question. So as you point out, Senator, and thank you very much for being here. As you point out, most of our health districts have multiple counties engaged. And so the process is obviously, I guess it's a majority of the counties would have to, if indeed you had certain counties today that didn't support the appointment of the commissioner for a district health director, is it by majority? Is that the way it is currently done, to help me to understand how the system currently works?
I'm not sure I can answer that. Megan may be able to. Again, just to clarify, now this is not a department bill, so she's answering your question just because she's knowledgeable.
Yes, sir. Thank you, Senator.
I believe, Betsy, does it say in code if it needs to be a majority? And while you're looking it up, I'll tell you a little bit about how the current process is. So right now, these are state positions. They're posted on the DPH careers portal, and individuals can apply to that through that website. Dr. Toomey makes a selection, or whoever the commissioner is at the time. And then they go to every county board of health to seek approval of that decision. So they're sort of pre-selected by the commissioner, and then she has to go get the approval. But I believe the statute says something about.
It just talks about, it's actually on line 25, the strict language.
Yeah, I think I understand. I saw the stricken language, so that makes sense, but it just wasn't very clear. So I think likely that is how it currently works, and we would be, of course, removing that. Okay, thank you.
Okay, we have one more person that wants to speak. Sherwin Levinson. Mr. Levinson.
Thank you for hearing me today. I appreciate it.
You'll just tell us who you are. And
I was going to say, you don't know me, so here's a little bit about myself.
Okay.
I have an MBA from the University of Chicago. I worked 25 years in top management, and then the next 25 years as an independent consultant. At the same time, for the last 14 years, I've been executive director of MRC GEM, which is the all-volunteer nonprofit medical reserve corps that serves Gwinnett, Newton, and Rockdale County health districts. Just to give you a little idea of what we've been doing in our ongoing support of the COVID-19 response, our 2,300 volunteers have provided over 7,300 hours of support through the end of last month. So yes, our health district is working.
Good.
And I'm going to throw away my 2 pages of notes because Mr. Will already said a lot of that, and just say that I agree, and we all want the best for the citizens of our state. There are health districts that are just not working, and it's a complicated situation. I don't think that without local support, they can work. I don't have a solution to how you will get that local support. I don't think you will get that local support by imposing somebody the local boards of health do not accept. If you can't get a majority of a local board of health to accept somebody, there's something functionally wrong. And I don't think dictating that person will make the change. But let me make another suggestion. Let's not break what's not broken. How about exempting from this the ones that are accredited? So we keep the ones where it is working without any change, because after all, regimes change sometimes every 4 years. The director of the State Department of Public Health may change every 4 years and have a little different agenda. And that continuity is extremely important at the local level. In the 14 years I've been working with these folks, there are only 2 people, and those are 2 who volunteered, who aren't still there. And that's part of why this group is so successful. They have wonderful corporate culture. They are all super dedicated to what they do. And the other thing is they have local support, and they've worked very hard to get that local support. They've partnered, they have regular meetings with all of the local community leaders, with the political leaders, with the school district. The school district nurses are assisting with our vaccinations right now, where we're doing 2,000 a day and could do more with more vaccine. So they've worked very hard to develop community relations. And I don't think that this can work without that level of support. But if it's felt that they need to have somebody placed who they may not support, then don't hurt the ones that are working. Recognize that those who have national accreditation are doing things right, and have at the ones that aren't.
Thank you. And do you
Thank you.
represent the same area as Mr. Krill, or?
As Mr. Will, yes, Gwinnett, Newton, and Rock. I live in
Okay.
Gwinnett County.
Okay, so y'all all represent the same area.
Yes, ma'am.
Okay, and you know, it's not a given that the person chosen by Dr. Toomey would be disliked by the boards, or that she would, I mean, as a good administrator, not try to pick somebody as a good administrator that the board could work, I mean, that the board could work with, and it was going to be, I mean, that is not a given as you would seem to make it, that you would assume that Dr. Toomey would not do everything possible to pick a person that would be compatible.
I'm not even making assumptions about Dr. Toomey. I'm thinking about Dr. Toomey's successor and that person's successor, because this legislation, as you know, isn't that easily changed. Things tend to stick for a while, but my assumption is that right now, they can't seem to find people who are acceptable to both Dr. Toomey and the local boards of health. And if with the current situation, they can't find acceptable people, I don't see how they'll find good people who will want to serve in those roles, knowing that they don't have local support.
Okay, other questions for members on the committee? And we do change rules frequently down here, sir.
Okay.
I mean, they're not written in stone or last another 50 years. We change things all the time from one year to the next.
And I do personally appreciate what you're doing. I know it's a sacrifice for many people.
Well,
sit
and I
there.
really appreciate the fact that y'all have such a well-run, and my thing is that I think they ought to send your guys out to be an example. I tried that with, who's the governor from Marietta? I mean, with Governor Barnes on his education thing, because my schools are extremely good in my district, and kept saying, why don't you send, instead of changing my schools, send them out to be examples?
Well, please not during the pandemic, but I feel certain that the folks at GNR Health would be happy to go out, and also that people from other districts could come and observe what they're doing.
I mean, I really do appreciate the fact that you are good, and Representative Barr has talked about it, and Representative Barr.
Yes, I appreciate that. I just want to again thank you on behalf of Gwinnett County and all you do and your team, right? There's you do have hundreds of volunteers. I've been to some of your trainings. Y'all are exceptional individuals, and especially during this time, just putting yourselves out there and in a huge way and helping our county. I'm very, very grateful for what y'all do. Thank you so much.
Oh, you're quite welcome.
Thank you for coming. I really appreciate it.
Thank you.
Representative Fry.
Thank you, Madam Chair. Real quick, I just have 2 short questions. One for Mr. Will. Can you tell us the difference between this county supplement to the director and what the state gives?
I don't know the exact dollar amounts, but I do know that the state, the district health officers are state paid employees for their basic salary. And then each are eligible to get a county supplement if that's allowed. And so we also, for instance, pay our nurses county supplements because the nurse shortage in the metro area. So it's not the only person who receives it, but they can do that.
So that means
Okay.
that means that some counties have the option not to give the directors extra money or to pay it varies across the state, correct?
It can be vary across the state, correct?
Thank you. Okay.
And thank you, Madam Chair, to the author. Senator Burke, do you feel like this will help us get the vaccine out in a little bit better fashion than we've been doing lately by changing the infrastructure just a little bit?
I think so, but to me, the common sense thing is, again, I certainly want to echo the Gwinnett Rockdale organization obviously is doing stellar work, and I want to recognize that. But Chairwoman Cooper, it's amazing all of the thoughts that were going through my head that you voiced, so I don't have to. But
I'm not as nice as you are.
well, I'm not sure about that. My wife might argue at that point, but we wouldn't be having this conversation if every health district was like Gwinnett, and I wouldn't be up here. We've been talking about public health in the 8 or 9 years that I've been up here, and we've just talked about it. And I think it's way past time to make some changes. And I think this is just a very, very small measure. I think any commissioner obviously will have to get the support of her local health districts if she's going to be effective, he or she. And I don't see that changing. The funding is complicated, but I don't think it's something that we can't manage. So I feel fairly strongly that this is a good measure and a right first step. But obviously, this is a legislative process, and I'm here at the will of your committee, Madam Chair.
Other questions for the committee? All right. Oh, no, just. Okay. Don't get, we're at the portion, what's the will of the committee? My motion to do pass, do I hear a second?
Second.
Is there other questions or discussion from members of the committee? Hearing none, everyone in favor of the passage of House Bill 256, say aye. Everyone opposed, no? Okay, the ayes have it. Thank you very much. And that is the last thing that we have on the thing. And I will say to the people that testified, and there are some really, a couple or three really good districts working. And I hope if, we can allay people's mind. I will talk to Dr. Toomey and send word to Dr. Toomey. I would think that she will have so much work should this bill become law, working on the ones that are really having problems, that everything probably, and the other ones that are working really well, she will say, thank you very much. And they will continue to function as they have been. I can't put that in stone, but I know that if I was going to be the commissioner and I had 10 areas that were not functioning well, and I had 3 areas that were, I would not be dwelling my time on the ones that were functioning.
That's exactly right. And Madam Chair, your body and our body have put substantial resources this year towards public health and leadership positions. And I think we're setting them up for success for the future, but it's going to take a coordinated effort to get rid of some of the, similar to the HIV language in the bill that Senator Huffstetler and you've been leading. There are things that we're doing now that, as the gentleman mentioned, we've been doing for 50 years that are not working, and we've got to modernize the public department.
And I'll get a plug for public health. Public health has been a backbone in the century before this one, starting in the early 1900s, with getting health in states. And we need to get back to that, and they can be one of our safety net across our state in delivering healthcare to our most needy citizens and citizens that live in counties that don't have a physician or a lot of their people don't have transportation to go to the next county. There's so much that they can do. And I will tell you that that's the vision, is that they will do this and reach out, and that it will be funded to help our citizens across the state, especially in the areas where we are lacking in coverage now. And public health is wonderful. When it's working at its best, it's wonderful, and it can do that again all over our state. So thank you, sir, for this one. And thank you to the members, and we are adjourned.
Thank you.
Representative Hogan,